Let me tell you the biggest gap in Medicare. That is long-term care. So if you have some sort of cognitive impairment or you need help or supervisory help with 2 out of 6 activities of daily living, Medicare is not going to cover that for you. Medicare does have some skilled nursing care coverage, so in other words, rehab, but that is different than long-term care. So what do people do to pay for their long-term care? Well, some people, they self-insure. So in other words, they have savings in the bank or wherever they have some safe money solutions, and they know they're going to turn to that money if they need that kind of help. Some people rely on their adult children, but most people's adult children are still working, so that's not necessarily a great solution. Some people end up on Medicaid. That means they've had to spend down most of their assets, and then the state is going to help cover that kind of care. But what I tell people to do, to learn about, is insuring long-term care. What you can do is you can transfer some of the risk to an insurance company. So in other words, you can get some sort of a policy, whether it's traditional long-term care or hybrid policies that are out there right now where it's life insurance combined with long-term care, so that you have some assets that you know will be in place to help protect you if you do need long-term care coverage. The one thing I want to tell you is if this interests you at all, the time to look into long-term care insurance is while you're healthy. Because guess what? Obviously, like any insurance, if you have the type of health issue that you need long-term care for, they're not going to give you that kind of insurance. So you got to do it while you're healthy. So if it is something you do want to learn about, reach out to me here. I am happy to talk to you about it the same way I talk to people day in, day out about Medicare. So just something to think about.